I'm very happy to talk to you today about the mental health strategy at Wellcome. For many of you, you may be new to our mental health strategy because just over the last sort of 12 to 18 months, Wellcome's undergone a reorganisation with a new focus and a new strategy. So I'll first of all give you an overview of Wellcome's research strategy overall, and then I'll focus in on mental health specifically. So as many of you know, Wellcome is a leading biomedical research funder, and the main work of Wellcome has not changed in that the bulk of our funding will still go towards what we're calling discovery research. And that's really blue skies, basic research funding that's aimed at any discipline, right from humanities and social sciences, right through to sort of any scientific discipline, which is going to improve insights into how to improve human health. On top of that, we have instituted 3 health challenges, which we think are going to be, over the next sort of 10, 20, 30 years, major global health challenges that will face humanity. These include infectious disease, the health effects of climate change, and mental health. So we're really excited that mental health has been earmarked as a key health challenge. And it's important to say that mental health researchers can apply to Wellcome both through the mental health challenge area, which is going to be the main focus of my presentation, but also through discovery research. So if you have a research project that doesn't quite fit within the focus of the challenge area, but is still a basic research question related to any area of mental health, you would be eligible to apply for discovery research. So what about mental health specifically at Wellcome? So we're hoping to drive a step change in mental health science with the aim of finding more effective mental health solutions or refining and tailoring the use of existing ones. And similar to what Greg said for NIH, we're interested in both understanding and intervening. The mental health challenge area has a specific focus on understanding and intervening in anxiety, depression, and psychosis, and particularly in prevention and early intervention. But I want to emphasize that we're defining these constructs very broadly to include constructs such as OCD, PTSD, postnatal depression. So it's a very broad definition, and we're also not wedded to a particular diagnostic system. In addition to work aimed at understanding and intervening, we're also very interested in building a more integrated field of mental health science. So in addition to our evidence and translation teams, we also have a field building team whose sole focus is to help build bridges across silos within mental health to build a more cohesive mental health community. We're also particularly interested in including the voice of lived experience at every stage in the research process and also in the work that we do as funders. So we also have a dedicated lived experience team. I just wanted to point out a few current funding opportunities that you may be interested in, with a particular focus on our current funding call on sleep and circadian science and how that might inform understanding or interventions for anxiety, depression, and psychosis. Just a little bit more detail about our remit. We're very agnostic as to methodology and to scale of analysis. So we'll fund teams doing basic research from subcellular to social aimed at understanding. And we will also fund clinical research aimed at novel or innovative mental health interventions. These can be either pharmaceutical or non-pharmaceutical. As discussed by Greg, applicants must use the agreed core measures in their research, and the common measures is a key focus of our strategy as well. I particularly wanted to talk about the role of data in our strategy, which is a key component. A few examples of recent projects which involve many of the people in this room, using a variety of different funding models Through core grant funding, we are supporting the Born in Bradford Age of Wonder cohort to follow this place-based cohort into adolescence with a focus on mental health. We also hear later from Mina, who will talk about the MindKind project, which is aimed at working out best models for equitable data collection from young people for mental health measures. And we are have also recently funded projects for a Wellcome Data Prize in mental health. This is where we've particularly been lucky to gain expertise from Anne John, Louise Arsenault, and our external partner, Social Finance. This project is aimed at encouraging researchers to use existing data to provide research insights, but also develop new data tools for helping us to understand particularly how anxiety and depression resolve in young people. Just wanted to sort of note our what we will not fund and our rationale for that. So as I mentioned, we are focusing on anxiety, depression, and psychosis, broadly defined. It was a tough decision to decide where to focus. We focused on these three because they are either among the more prevalent conditions or among the more disabling. In many cases, for depression particularly, both of those apply. But we do appreciate that there are other mental health conditions which are equally worthy of funding. And I would point researchers towards our discovery research schemes, which are open to funding on any mental health condition. And finally, I just wanted to end with a slide, just focusing on lived experience, because this is such a key part of our strategy. Of course, still a work in progress, but we're particularly interested in involving young people with lived experience in our day-to-day work. So we don't just ask our researchers to include those with lived experience in their proposals. We also have young people with lived experience helping us to develop the remit for our funding calls, to sit on our funding panels, and to work with us in how we communicate about our strategy with the outside world. So yeah, very happy to take any questions, I think probably in the discussion rather than now. Thank you.
Testing. Does it work? Yeah. So to start off, many thanks for the organisers for the invitation to talk to you. I'm David Baghurst from the NIHR, which is the National Institutes for Health and Care Research, a UK funding body. Is there anybody here who's funded in any way by NIHR? Brilliant. I'm sort of very relieved to see that, given the context of the talk. So the main thing that I wanted to achieve from today actually is just putting my email address up, so that we can have a dialogue. I'm very interested in kind of reaching out to the research community, learning about research priorities, learning about research gaps, learning about how NIHR can provide a better support service to the research community. So do get in touch with me if you have anything you want to talk to me about. For those of you who don't know NIHR, we are a funding body that has a number of different schemes and programs. But in essence, what we do is we fund the development of research capacity. So we do training programs, we fund training programs. We fund individual research projects and programs. We provide some core funding for what we call infrastructure, which is essentially big teams of people. And we also support studies through funding underpinning research study support capacity, so things like research nurses. Latterly, well, we were known for a period of time as the research arm of the NHS. That isn't a very accurate description anymore because we cover lots of areas of social care and public health, but also in the past few years, our sort of remit has expanded to include some global health research, so funding research collaborations between the UK and low and middle income countries. And all of these different schemes and funding programs, including the global, have supported mental health research, and all of these different initiatives have also funded data and linked data sets related research. So that's kind of what we're about. The mental health research investment spans all of the things that we do. We support the cross-funder mental health research goals 2020 to 2030. We support the mental health research incubator activity. So a number of you are early career researchers. Encourage you to get involved in the mental health incubator. It's a platform that's been put together to help with early career researchers' development of their research careers. It provides training opportunities, peer mentoring opportunities, and other mentoring opportunities. Under something called the Mental Health Research Initiative, we've recently launched a connected set of challenge calls, specifically to kind of try and address some of the gaps or some of the concerns that have been raised either in the research community or the evidence user community. So we set about really trying to encourage the involvement of new disciplines in mental health research, trying to make sure that patients, service users and carers in new parts of the country had the opportunity to take place in research. So trying to bring more research opportunities to more people in the population. And I just wanted to flag just a few of the things that happened under this mental health research initiative. So first one up at the top, we have a regional funding scheme, Research for Patient Benefit. We launched a mental health research in Northern England call specifically to bolster the volume of research activity, the research capacity, and provide access to more studies for populations in the north of England. We benefited from, on the second one, the Invention for Innovation program. We benefited from some research prioritization activity that we were involved in, that Parissa was involved in. So to really flag up the opportunities that have been highlighted through this research prioritization exercise for digital technologies for children and young people's mental health. We did some cross-school funding, so we have schools for public health, primary care and social care. We dropped some funding into those schools where they were encouraged to have cross-school funding activities, so projects that would sit between primary care and social care, primary care and public health and social care. We did a program development grants call in the area of mental health. So program development grants are early stage funding to allow communities to come together to design research programs, complicated big research programs. The funding is available up to about 150K. And out of that, you should spend some time, get some communities together, and end up with a complicated program of work. Typically £2.5 to £3 million worth of funding would follow from a successful program development grant. And we supported in the mental health incubator, we funded something called the GROW program, which is a one-to-one mentoring and training program for early career mental health researchers. So that's it. The take-home message is email me. If you all email me tomorrow, it might take me a little bit of time to get back to you, but very interested to kind of have conversations. There are lots of challenges out there. You know, we've heard already in the talk so far about some of the challenges. NIHR wants to make an appropriate contribution. Very delighted to talk to you about your ideas. Thank you very much for the opportunity.
Hello. I think my slides were there. How do I put them back on again? There we go. Hi, my name's Thalia, Eley, and I'm at King's College London, but I'm also the Deputy Chair of the Fellows Panel for MQ. And I've only got 4 slides. My presentation is very brief, and it's really aimed at the early career researchers and those thinking about fellowships in the room. So our MQ fellowships, the basics of them are outlined here. So the award is £225,000 for 3 years worth of research. And the idea is that the sorts of projects that we want to fund enable transformative advances in mental health research. So we really want people who are thinking really creatively about what they're doing. The sort of classic area of interest is depression and anxiety, also borderline personality disorder, and these are all really at the heart of the MQ goals, which are to tackle areas of mental health that have been traditionally under-resourced compared to, say, the big conditions like psychosis. And a particular focus at the moment is premature mortality, and so things like suicide or comorbidities and the impact that those have on people's lives. The research can be undertaken anywhere in the world, and it can be utilising any discipline as long as it's relevant to mental health research. And in fact, we're particularly keen on interdisciplinarity, and by that we mean genuine interdisciplinarity, so not just sort of doing one thing in one area and one thing in another, but thinking about how bringing different areas together can further advance an important contemporary question. So this is not necessarily specific to MQ, but relevant here also. This is in fact a slide I use when I'm doing grant writing workshops and fellowship training at King's. And so this is what most funders are looking for or assessing you on when they're thinking about fellowships and early career stage funding that funds you as an individual. And it's thought about in these sort of 3 broad ways. So the first one is the caliber of the person making the application. And at an early career stage, that can be quite hard to demonstrate, particularly for early postdoctoral stages. Classic things like publications and awards are obviously going to be on there, but awards needn't just mean funding that you've received. It could also be travel awards or awards from your university at any point in your career. So undergraduate project prizes are worth including. Anything that really just shows that you're somebody that's gone the extra mile at this stage of your career, that's already been evidenced. And then in terms of the project, it's really the classic sort of 2 things that we're often looking for as funders when we're thinking about funding new research. So that's the significance and the innovation. How important is it, and how timely and contemporary is it, and new? What new knowledge are we going to get from funding this project? It's also really important to make sure that it's realistic, and there are different ways that you can demonstrate that. One of our favourites is when there's some pilot work or some kind of feasibility work in there. If you're going to be connecting multiple different sources of data, can you demonstrate that you've done some of that already? If you're using a new assay, can you show that you've got it working in your lab, or is there somebody who's got something similar working in the lab? This kind of evidence of careful planning, and importantly having a backup plan for anything that's got a medium and especially a high level of risk is something we really like seeing. So having a whole paragraph about what you're going to do if this experiment doesn't work is something we find impressive rather than worrying. So I do encourage you to think about that. I would also put in there training opportunities, because we hope at this career stage that you'll be thinking about developing your skills, moving outside of your comfort zone, thinking about what new skills might greatly enhance the kind of portfolio of tools you have available to address the questions that you're identifying. And so those training opportunities can be purely about skill development, but would also ideally feed into what you're then able to deliver with your particular project. And then the third thing is the environment. And so really this is about showing a good match between what you're proposing, the skills you're wanting to develop, the tools you're wanting to use, the resources you're going to need, and that there's a good match between all of that and the institution you're proposing. So one of the things that is a little bit tricky for all funders, I would say, and I've sat on MRC and Wellcome boards as well, particularly for early career fellowships, is if you're planning to stay where you've already been for quite some time. It's not necessarily a complete no-no, and sometimes there are going to be personal reasons why you need to stay in a particular geographical environment, and that may really be the only appropriate institution there. But do try and at least move group or a department or something to sort of show that you're not going to go on working basically with your PhD supervisor. That's what we all want to see. We want to see evidence of independence growing. So if you have to stay in the same institution, then try and show that growing independence in some other way. But if you can move to a different institution, that's even better. And wherever you are, it's important to show that match between the resources the institution provides and the ones that you need. And sometimes it's going to be suitable to spend a bit of time at a different institution. And again, if you can include that, that's something that we like to see. And so, yeah, these are just some examples: the data, the labs, the biostat support, the kind of things that an institution might offer that might be relevant to you, and experiencing alternate environments I've mentioned. So here's some tips just for thinking about writing any kind of fellowship really, but also an MQ fellowship. And I've kind of broken it down into the planning stages versus the writing stages. And some of this I will have mentioned briefly already. But in terms of the planning, it's really, really important to involve people with lived experience so that they're there at the centre of what you're doing, and what they believe it's important to understand and to build knowledge with regard to is at the heart of what you're thinking about. So it's no longer us as scientists saying we think this is important. It's us consulting what are they telling us is important, what are the communities asking us to learn more about and to improve. And if you haven't got the resources or the scope to do a piece of work about that specific to your project, there's quite a lot of initiatives out there by organisations like the James Alliance that can tell you what priorities have been identified for specific communities. So you can sometimes draw on those, but if you possibly can, talk yourself to individuals who've made it clear that for your institution they're willing to speak on behalf of individuals with lived experience, and that could be really helpful. In terms of the planning as well, obviously you want to be really clear on what the priorities and key themes are that are being highlighted by the funder that you're writing to. So when MQ proposes a kind of particular focus, it doesn't mean that we absolutely won't look at things that don't wholly cover that focus or include it, but ones that do are clearly going to be hitting more of our priorities than others. So it is definitely worth thinking about. And the interdisciplinarity, I would say, is pretty much non-negotiable for the MQ fellows, because they are so competitive that it's really important that people are taking on board how important that is as a focus at the funder generally. And as I mentioned on the previous slide, you do want to make sure that your question is innovative, important, and timely, all three. And if you're not sure about that, just ask a few of the independent PIs in your local institution. One of the things I think it can be really helpful to do at an early stage is just write an abstract outlining what your question is, what you think you'd like to do to answer it, and what you think would be learned from that and why that matters, and send it to a few people that you trust and get their feedback. If you feel reluctant to do that, I would encourage you not to feel reluctant to do that. Most PIs have been, well, they've all been where you are, and most of them are going to be keen to support the new generation coming up. And then, if you can possibly do any kind of preparatory work, pilot work, get some of the early steps in place, get some agreements in place for anything that you're definitely going to have to access, for example, then that all helps. So that's all in the planning stages, and it inevitably takes time. So it's worth just making a start on that as soon as you can in terms of thinking about when you might want to submit a fellowship. In terms of writing, I think it's really helpful if you use headings to guide your readers. Quite a lot of the funders publish the criteria that your application is assessed on the basis of. So actually, in almost all of these funders, there will be a board that assesses all the applications, and the board might be, say, 10 to 20 people. And then there will be a few people who have to prioritise your project, and you want to make it as easy for them as possible. So if you write the headings, then they know what to find where. Numbering your aims and following those through the whole way through so that the aims drive every other decision is really helpful. A few other things about visual aspects that you've probably all read while I've been talking. A timeline could be another helpful way of showing your planning skills, and power calculations. I really hate seeing applications without power calculations. It really winds me up. And they need to be realistic and accurate. So, you know, make sure that if you don't know how to do them, you've talked to somebody who does. And then this is just one last thing. Perseverance is so important, as is dealing with rejection. You will all get lots and lots and lots of rejected applications. That's just the deal, I'm afraid. This is a slide that I've stopped updating in 2015 because actually I had just found I ran out of time to go on doing it, and I'd moved away from doing as much KCL grant training as I had previously done. But this is just to show you awarded versus not awarded, and further towards that right hand side, more of the awarded ones are collaborations. They're not all ones I led, whereas the first half, they're mostly kind of fellowships and studentships and things. This is the birth of my 3 sons, and this was, one of these was an MRFIC fellowship that then meant I wasn't really allowed to apply for anything else, so that kind of accounts for that gap. But it just sort of contextualizes it all to say, you know, at the early stages, it's really hard to get things awarded. There's far more that are rejected than aren't, and that's just normal. And if that sounds a total nightmare to you, it's probably not the right career choice, because you just have to learn to brush yourself down, pick yourself up, get back on, get going again, and ideally have coffee with 5 people who are willing to chat to you about how to repurpose that idea and submit it to the next funding call. Right, that's me done.
Thanks so much to all our panelists. They were fantastic presentations, really useful and insightful, and lots of practical advice there from Thalia as well. Just before we open up for questions, I wondered, Greg, if you would like to comment on anything from an NIH perspective in terms of mental health research funding, just a few brief comments.
I just will say that most of our funding calls are in fact open to investigators anywhere in the world. That's not 100% true, especially not for fellowships, which are often restricted to Americans. But yeah, do have a look at the, there's something called the NIH Guide to Grants and Contracts, publishes every Friday. It's one of the more boring things you'll ever read until you find the RFA that's actually really dead on what you might be interested in. Our sister institutes, the National Institute of Drug Abuse, the National Institute of Alcohol Abuse and Alcoholism, all publish, and the National Institute of Neurological Disease and Stroke, all publish RFAs that might be of interest to some folks in the room.
Thanks. Okay, so now we can open up to general questions. Yes.
Thank you. There's a question for Thalia, really, but perhaps all the panel members. Just thinking of the guidance you had around what to highlight in your application for a fellowship. Sort of feel if you're a researcher with a condition that sort of limits your energy or your mobility or opportunities, and or you have caring responsibilities, sort of putting together a CV that makes you kind of ahead of your peers and moving institutions is much harder. What allowances or accommodations does each funder have for recognizing the fact that that person might have really useful lived experience and be a very good researcher, but not showing it in prizes or moving to a new institution?
So I've come across that at all 3 funders that I've sat on boards for, so Wellcome, MRC and MQ. And if there's nowhere on the form, which actually, I mean, Wellcome has a whole section specifically for that now, but if there's nowhere on the form, put it in your cover letter. Make sure we know, because we do take it into account. You'd be surprised how collegiate, supportive, pro-social board members are, because, you know, even if you're on a board that you get paid for, it's really not what you're worth. And we do it because we're passionate about the science and we want the money to be spent on the best possible science. And we want to support everybody who has that passion in doing it in whatever way suits them. So it is really common that we would have the women in the room saying, but have you noticed she's had 3 children? You know, I mean, honestly, I've not sat in a panel where that has not been noticed in the last decade. There's enough of us around now that we're really noisy about it. And the same goes for the other issues that you mentioned. So I think don't be shy about it. If you have a condition that limits your energy, if you have other caring responsibilities, not just parenting, just mention them in the cover letter, make sure we know. And sometimes that would mean you might take up a fellowship part-time, for example. And that would be a flag to it right there. And then you could just address it at that point. Yeah. Do you know, actually, that was unfair of me. I think it isn't only the women, but I think having more of us on the panels over time has made that an easier subject to just bring in.
From our point of view, we're very conscious of the timing and caring responsibilities and how they disproportionately land on some individuals. So we're allowing a lot more time. We're placing our deadlines in more sensible places where we're able to. If we've got something which is really urgent, we just have to do it quickly. But the majority of calls aren't that urgent, so it's fine.
I think one thing I would just add, what Thalia said is completely right about the space on the form. Also on the form, we emphasize the importance of research environment, and we want to see that your institution and that your mentor was putting in place any additional support that an applicant might need as well.
And actually, I just have, I have one other thought, that also that if you are on a fellowship and you then have something happen that means that you have greater responsibilities, and from my personal experience, I had 3 children all on one fellowship, and it just got more and more part-time and had more maternity leaves added to it. It went from 4 years, I think, to 7 in the end. And all the funders are extremely flexible in that way. I've really literally never heard of a funder not allowing that to happen. So I think just don't fear it. We all recognise that real life happens alongside our careers.
Yes, the question back here.
I don't know if you can hear me. Thanks for the overview of your funding calls. And I just want to ask, because we talk about data science today, and I noticed, and forgive my ignorance, it maybe actually I'm missing when I'm looking at the funders pages, but I wondered what's happening to mental health data science, and whether there is a space to actually for it to become a separate thing on funders kind of lists. I'm a data scientist and I work a lot with NHS. Routinely collected data, and whenever I try to fit my research or kind of my projects, I try to fit them within other teams or other topics, and kind of compete with lots of other things that are maybe more clinical, or people might be coming with very different, very strong proposals as well that are not necessarily data science driven. And I just wonder whether there is kind of any plans in the future to have a bit more separate streams that actually are mental health data science. Maybe not. Often I know they come under words like technologies, tools, etc. But how broad they are is quite scary to data scientists. So I don't know if you have any thoughts or comments on that.
David, would you like to take that?
Yeah, I mean, obviously most of our calls are open to anything. So you can apply for us, no problem at all. Where we do calls which are kind of more challenge based, it's where we're not seeing those kinds of proposals come through. So if you like, it's a failing. It's a failing in the routine commissioning to identify projects in a particular area, in a particular niche. So as things currently stand today, I don't think we're planning to do anything particularly focused around this topic area, because all of our schemes have supported projects of the type that you've described. But my email address is there. Send me an email. I'm genuinely keen to have dialogue.
Kat, did you want to respond to that just before the next question?
Yeah, I would say, as the projects I presented relating to data science have so far been sort of fairly ad hoc and using different funding models, whereas the funding calls tend to attract the more kind of hypothesis-driven research. But we are just embarking on a scoping phase where we're trying to understand the longitudinal data landscape, and we are interested in making data a more prominent part of our strategy. So I would say watch this space.
So I wanted to ask about early career researchers in data science specifically. It seems to me that they have a particular set of challenges to negotiate. That they come into a project and then they have to apply for permission. Some of that has already gone on, but it can last. Something that should have lasted months can go on for 3 years. That is typical for exactly that to happen. And then, so I'm thinking, I was thinking particularly about the MRC Data Pathfinders, for example, that funded early career researchers, but the data actually only became available particularly at the end of those projects. So early career researchers in data science can find themselves in a position where they've got 3 years to prove themselves, to develop a portfolio of publications, but actually that's nearly impossible. I think it's a particularly challenging area. Just wonder what your 3 organisations are doing to help support the careers of people in data science, where I think they face these particular problems.
That was actually one of the driving reasons behind our Wellcome Data Prize, where Anne was the chair of our recent selection panel. We recognised that problem and we wanted to support, but any researchers, but particularly early career researchers, to be able to get going on day one of their awards. So we worked with external partners, Social Finance, and with DataMind and other organisations such as the holders of the Saprin dataset in South Africa to curate datasets so that hopefully, in theory, we'll see whether this has worked, when the awards have been made, which is just sort of, we're going to be releasing that later this week, I hope, people can start working on their data straight away. The way that the prize works is slightly different from a typical grant model. We will have awarded 11 teams sort of seed funding to start analysing the data, and then we'll narrow it down to 5 and then 3 final teams who will receive a sort of larger award to further develop their research and also a data science tool alongside. So we're very aware of this issue and we are sort of experimenting with different models to try and get around that. I don't know if Anne wants to.
Yeah. Just from my perspective, having sat on, MRC and NIHR panels, what was really different about the data prize, and I guess it's worth all the funders maybe reflecting on what elements were different about it, was that it was teams of early career researchers partnered with lots of different sorts of organisations, and so it felt very different. So there was something in there that addressed some of the issues that you've raised. So, and I guess there's something about us as a community thinking about how we do that a bit more.
Yeah, I think where we've done things which are specifically data focused, then we've included in the commissioning process the people who administer the key data sets that our applicants will need access to. So they've seen our applications before the funding committee, and we can anticipate, if you like, the biggest barriers to the research being activated in a timely way. There are capacity constraints in the system, which are real, and we are in continuing dialogue to help see if we can chivvy things along. It's a particular problem in any kind of policy related research where the results are needed in the next 6 months, and it can't take more than 6 months to get hold of the data to do the piece of work. So it is a constant communication.
Thanks for the really informative points you all have made. I just have a question for the Wellcome Trust person. And you were mentioning the mental health challenge areas are focusing only on anxiety, depression, and psychosis. And I just wanted some clarification. Is that also for ECRs, or is that Is that correct? Or are ECRs allowed to talk about it or ask for funding for any kinds of disorders? And the other point was, you mentioned you were a bit broad in how you looked at those disorders. Does self-harm come as part of any under that umbrella at all?
So to answer your second question first, so I think we are interested in taking a symptom-based approach as well. So if you were able to make the case that self-harm was, a key component of depression or anxiety, and you were also, as well as self-harm, going to use our core measures to measure anxiety and depression, or psychosis, then you would be able to make the case for self-harm, but it's with those caveats. In terms of early career researchers, I think part of the confusion arises in that for Wellcome, one of the main funding opportunities for early career researchers will be the Discovery Early Career Awards. And I would strongly advise any early career researchers to consider those, whether they work in anxiety, depression, and psychosis or not. So you will not be disadvantaged as an early career researcher applying for an early career award to discovery research if you happen to focus on a research area that also comes under the remit of the mental health challenge area. Apology that it's a little bit confusing, but hopefully that's welcome news, because it means that for early career researchers, your work would be in scope. In terms of the mental health challenge area specifically, many of our grants at the moment are sort of larger, longer awards, although we are working on how we can enable early career researchers to contribute, whether as PIs or co-applicants. So do consider that as well. And another model that we have been using quite a lot recently is a contract model. So rather than a grants model, we will put out these requests for proposals for people to produce a piece of work for us, often in a much shorter time frame, often between sort of 6 to 12 months. And often they are quite well suited to early career researchers.
We're just at the end of the session, so I just want to thank all the panelists for that really useful and interesting session.